This is Joe Liu, founder of Joe and Amy Liu Foundation. With me is our distinguished volunteer, Justin. And today we're going to talk about why we're doing what we're doing, having this Lively Health program.
Hi, thank you so much, Joe, for having me. I love Lively Health, big proponent, and that's why I'm a volunteer here at Lively Health. Happy to speak today about various topics.
Good. I want to start with the reason why we're doing what we're doing is that we saw that we spend, as a nation, spend $4 trillion a year on healthcare, and 90% of them, almost like 3.6 trillion, spend on chronic condition related healthcare. Summarize that chronic condition is hypertension, they're mental related, such as depression and kind of a mood disorder. Obviously, this overweight induced diabetes, cardiovascular related diseases or conditions. Well, I don't want to call it disease, but just condition, right? So that means that the chronic condition means that this condition will stay with you for more than a year, sometimes all your life. So when we learn that chronic condition can be prevented and sometimes reversed, that's the motivation why we're foundation, Joe and Amy Liu Foundation, starting this venture, is trying to use an app, educate people, and gradually change people's behavior towards a healthier lifestyle instead of a risky lifestyle. So the fundamental concept is this app is very simple. Everybody understand, and it can be done in a couple of minutes. And just refresh your memory on what are the good, healthy lifestyle habits. And then you're using a very simple 0, 5, and 10 score mechanism, trying to not enhance your already healthy lifestyle, but trying to improve your weakness, right? So that's the fundamental. So and then there's people tends to be, number one, educated, and then have that desire to change behavior, and then using this app initially probably on a daily basis. Over time it could be a weekly or monthly. Just refresh your memory and how to eliminate your weakness. And then towards what we call holistic health. Holistic health generally means that not only your physical health, your mental health, and your financial health and social health, as well as medical health. And these are simple and easy to do lifestyle habits. And then we have only 10, we only preach 10 area. And if you cover this 10 area, according to Stanford and Harvard public health research result, and that could easily put you in a health condition, but also can extend your life for more than 10 years.
And who doesn't want to extend their life for 10 years?
These are evidence-based research. We only integrate that into the app, but there's a lot of hard work done by advanced these institutions trying to improve people's health, and then there's this massive study behind that. So we incorporate basically the app is incorporate the Harvard 5 good lifestyle habits, including Stanford's financial, Stanford's social concerns and the eating habits. Plus that we have some volunteer, Dr. C.P. Chang recommend that everyone needs to do regular checkup. Blood check, and regularly check your blood pressure and your BMI or your weight. Thus that it's really a self-directed preventive care. You manage your health, and it's great for you, for all your life, and it's great for a family. If you do have a family, then you have that leadership, and taking care of the whole family as well as the society. Just imagine if everybody is healthy in this country, our healthcare budget could be, going down to 1 trillion. Imagine 40% of the healthy people only use 10% of the total budget.
Yeah, I think, what really inspires me a lot about Lively Health really is that kind of aspect of preventative care, right? I mean, you were mentioning the budget and or how much money, America don't get me, am I correct in saying that United States, we are the #1 in terms of healthcare costs in the world, like by a far number?
We outspend everybody.
And we have so many problems, right?
We outspend everybody, but our life expectancy shamefully ranked number 46 among nations. Yeah. There's a lot of room to be improved, and then it can be done.
Yeah, no, that's what I really love about Lively Health too, is because a lot of these things, it's like in America, it's always like incentivized by insurance companies. It's like, well, we're not going to invest in you from an early age because you might not be on my insurance, like as an insurance company, 50 years down the road, it'll be another insurance company's problem. So it's actually more beneficial financially for us to not give you that care today and now, right? So I think that what then happens is that a lot of these, as you were saying, chronic conditions, they don't appear until later on in life, and sometimes they appear after all these negative, unhealthy habits kind of start to take root in our own lives. So having just what I love about this app, and when I first, got to know about Lively Health is, I kind of was thinking like, oh, wait a second, what am I doing with my own life? And just kind of thinking like, I should be more healthy, right? Just being more cognizant and conscious of like my own health and, what am I doing, to, be healthy. And I think that's these like the 5 pillars of health that you mentioned.
Yes.
Right? Those are kind of like key indicators that I can think of myself going about my daily life, doing these healthy habits, these 10 healthy habits, and scoring myself on the app and whatnot. And I don't know, I've definitely had good lifestyle improvements in my own life, I think. So I think that's something one of my takeaways, I think.
I think that's the basic, is starting from educating yourself.
Yes.
That chronic condition can be preventive.
Right.
And earlier you mentioned that the health insurance industry, I think that they're also trying to do this preventive care.
Yeah.
For example, like Kaiser, and many others already practicing this, kind of an integrated healthcare service, from taking care of the insurance side, but also provide the service side.
Because if everyone does it, then everyone benefits. But then there's no guarantee other insurance carriers do that.
I think that we as a nation needs to have a movement towards more conscientious to our lifestyle habits. And if everybody building that conscientiousness over time, and we could expect our next generation live, beyond 100 years old. But that requires, kids from the early days get the right education and continue to keep that, lifestyle habits.
Yeah, not always getting the Happy Meal from McDonald's, right? Not always doing that.
Let's not call names, okay?
Oh, okay.
But we just need to change the kind of a society towards a healthy lifestyle, right? It's very much like, we look at the Sierra Club, trying to preserve the nature, right?
Yes.
And over time that we have the best park system among nations.
I think that's fair to say. I think that's true.
So it all starts with some volunteers trying to do some stupid things, right? like what we're doing, trying to changing people's lifestyle habit. It's an uphill battle, but I think it's very meaningful, and it's meaningful for our next generation, so that our healthcare costs will not exceed 20% of our GDP. Most of the nations probably only spend 5 to 10% of the GDP.
Yeah, that's actually one thing that I learned, by being a part of Lively Health, is this aspect of, if I, improve my own health, right, then I can also maybe help society by maybe not having to go to the emergency room or something down the road, or, do an expensive surgery. Because just imagine if every person was more cognizant about their health and took these preventative steps, then I think overall, in terms of a trend, you would see a lot less negative impact, financial impact on our healthcare sector, right? But but even for me though, I love personally being healthy, feeling healthier. And so when sometimes people ask me oh, Justin, I heard you're volunteering for Lively Health, right? I don't usually say I always say, I'm just a volunteer, but I also encourage everyone, it's not just just being a volunteer and being an advocate for it, but really just being an advocate for yourself and for your own health, and just kind of sharing that kind of positive, that positivity of oh yeah, I'm feeling better, I'm feeling healthy, I love it, and I think it's something anyone can try out, really.
Exactly, it's very easy to very easy to download, very easy to use.
Yeah, it's so easy to use.
Follow. And we keep the data for you, And I just want to reiterate, this is a charitable
nonprofit, yeah, 501c3, yeah.
There's no commercial interest on the data.
Yes,
so
right.
you can feel 100% comfortable that we collect some data for your own tracking purpose.
Yeah.
And tracking is very important,
it is,
because you're maintaining your own health, right? So speaking about experience, I personally, even in myself, upon involving with this project, then I realized that it's so important. We have about 20% of our population have mood disorder or depression.
Yeah.
I didn't know that before.
It makes sense when you say it now.
So one of the lifestyle habits is to encourage people positive thinking.
Yeah.
Thinking positive. Anytime that you run into challenge or difficulty or stress, think positive and then trying to make a difference, trying to change your lifestyle, right? Make a difference. Don't go into the kind of a narrow, cumbersome, thinking process.
Yeah, that makes sense. Yeah, kind of just a framing, like a mindset change, like how you frame things. Like, are you a half glass empty kind of person or a half glass full kind of person? Like,
just think positive in general.
Yeah,
just think positive. Another thing that is very interesting is that Stanford, they're trying to emphasize financial planning. So just imagine if you getting kind of a mid-age or old age, and then you don't have any financial support for retirementhood.
Right.
Then it would be it create a natural stress.
A lot of stress, then you can't take care of your health
So you gotta train that saving behavior from early on, right?
And that's the financial pillar,
that's
or the health,
right? Financial independence.
Independence.
We look at the health independence, and always also looking at just financial health independence. And another important thing is social, right?
So we covered mental and financial. Now we're on social. Social. Right. Okay. Yeah.
Social. You gotta have that support.
Yeah.
You know, when you run into difficulties, then you know that somebody is behind you. Or you have friends, you have relatives, you have
feeling
colleagues,
supported by others.
That's right, supported by others, right? And that's one of the key, or all of these are key ingredients for holistic health.
Yeah,
let alone that we did talk about medical checkup, regular medical checkup. There is about 20% of the chronic condition come from lipid disorder. Lipid disorder means your blood check. So you can find if you are over, if your numbers are out of the spec, and then you can make changes, right?
Right. That makes sense.
So and then also routine checkup. Every 6 months, every year, go to see your doctor and do even though you feel healthy, right? But doctor may find something that after checking your blood test.
Yeah, that's true.
And advise you otherwise. Yeah. So,
it's kind of like going to the dentist and then not realizing or thinking you have a cavity, but then the dentist saying, "Oh, you have a cavity. You should come back."
After the X-ray, you find something.
They find something. But it's important otherwise.
So I think that kind of summarize what we talk about it why we're doing this Lively Health app.
Yeah.
And the intent is trying to educate more and more people, especially the young ones, not necessarily for the seniors. The young ones, you need to build that good lifestyle habit.
For all the things,
away from those risky lifestyle habits. No bad habits, no smoking, no excessive, alcohol drinking or recreational drugs. Forget about that.
Right. And even things like financial, it's like just being aware that it's important to save money too.
That's right.
Yeah.
I think that all summarized to go kind of a mainstream and then not to go take the risky approach.
Right.
Have some kind of planning towards latter part of your life is preventive.
Yeah.
So I hope that this my audience starting to download Lively Health
app.
Lively Health app, and then also go to YouTube, check Lively Health. We have a series of
pretty good content, I think.
We have lots of videos. That kind of hold your hand, into a different lifestyle.
I'm definitely learning new stuff for sure.
We have a beautiful girl like Yumi, and we have a handsome young kid Ray, and all our coming to the foundation for trying to do this.
And what I love the most about it is all the positive energy from everyone on the
team,
on the team, all the volunteers. I think that's what I love the most about it. Like so much positive energy, and I feel like wow, I'm motivated to be healthy too.
Yes, and at the same time helping other people to stay healthy.
Yes,
right?
exactly.
And at the end, I think not only you benefit, your family benefit, and also the society. Get some relief.
I definitely got my parents to download this app, so
yes.
I'll say that.
So I think this is a great opportunity for us to share some of our thoughts right, to our audience.
Yeah.
I hope that benefit more and more people. And then
so
people wants to be volunteer. Don't be shy. Just because this is go to the globe. So people wanting to participate and be a volunteer, contact us. We will help you to get started.
Yeah, please do. It's just like being a good neighbor, and it feels great to spread the good word, right?
Yeah.
So yeah. All right.
And thank you for watching.
Thank you so much.
If you like our video, please download,
like, and subscribe.
Like and subscribe. Yes. Thank you.
All right. Bye bye.
Bye bye.